Welcome, everybody, to our next installment of our SCI Connections series. This is a quarterly meeting that we hold with the North American Spinal Cord Injury Consortium. And I want to thank everybody for coming by and being part of our day today. We have some great speakers, and it's great to connect with you, as we always do during this difficult time. Today, we've been blessed with having two great speakers, but today's agenda will be really, I'm going to give a brief overview of the North American SCI Consortium and what we're all about. And we're going to take a brief poll at the beginning of our webinar today. And then we have the great opportunity of having Alexandra Benowith from the United Spinal Association to talk, as well as Peter Athanopoulos from SCI Ontario, as well, to speak about what the great work they're doing back in with their organizations. We'll have a bit of a membership discussion at the end to talk about our next webinar, and then we'll always, as we always like to do, have a call to action and talk about what we can do as a community moving forward. So the North American Spinal Cord Injury Consortium was brought together approximately a year and a half to 2 years ago, and really was an answer to a dire need to have our community represented more in all things SCI, which includes research, care, and policy decisions. We serve all the people throughout with SCI, including their families, SCI-led organizations, both local, regional, national, and international. We like to try to bring together all of the great organizations that are working on the front lines, but we have the opportunity of really bringing together these resources on an international basis. We facilitate communication, we share these resources, and we enhance collaborations to improve research, care, and cure, and policies impacting our collective community living with SCI. And really, we want to help all of us together, both as individuals and collectively. We can establish effective partnerships between our community and other stakeholders in government, research, healthcare, and industry. And we can connect the dots across the wheel of translation to create more meaningful change. As you can see on this slide, these are the many organizations that are members and who we represent with the NASCIC and North American SCI Consortium. There's over 288 members per se, but that basically is made up of individuals, organizations, and people in industry, and really represents almost 700,000 people across the great continent of North America. There are really three types of membership with NASCIC. There's a principal member, which is really a consumer-based organization that they can be an outright member of NASCIC, normally national or international and regional charities, both in the US and Canada, and as well into Mexico and Central America. We have a category for patron membership. This is any individual living with a spinal cord injury that's either directly representing a person with a spinal cord injury or a caregiver family member with a main objective to represent themselves and not an organization unto its whole. And then we have a partner membership. This is an organization or an individual with any interest in activities related to people living with spinal cord injury, but do not meet the above membership category. So this would be people, representatives, researchers from pharma and biotech, model centers, hospital settings, and basic researchers. All of them can fit within the partner. Really, it's a big tent when we're allowing everybody to work together underneath it, but we thought we'd just designate these separate membership categories so people can better understand what their role may be. For more information on membership, please go to our website at the NASCICconsortium.org membership, as you see on the slide here. There are great membership benefits when you become a member of NASCIC, and that's really, I think the best example is the exchange of information, where we have the great opportunity of, even today, having two qualified, amazing advocates representing different parts of the continent coming together and sharing ideas that in some cases might be distinct and different in their regional settings, or might be very common in terms of what's happening throughout all of North America. We have the opportunity to be in that exchange level and helping us share great ideas. We drive the change by sharing your lived experience, engaging directly with the SCI community to enhance your research, care, and products. Participating in projects to move research to care. We have a great project review committee, and they really help generate some great partnerships in the projects and how we can move things forward. But more importantly, as always important, strengthening the voice of the SCI community, meaning we as people with lived experience are at the seat of the table here, and we have the power and the ability to dictate change, and we help as NASCIC to facilitate that. And by being a member, you can really help engage what we do and help facilitate the great attributes that we have as people with spinal cord injury, and helping to change and move things forward for the betterment of our community. Again, here's a nice glossy slide that shows you a bit of the journey of how it works and how we bring things together. For example, in the project review community, you can see how we take an idea, we move it forward. And then an example was SCI 2020, where we spoke as a group, and were invited to speak and representing the community at the National Institutes of Health conference, where they wanted to hear our voice. And then again, we have our annual meetings, and we've even, as of today, moved forward to what is now called the SCI Moving Forward webinar series, which was a direct really result of addressing the concerns of the COVID-19 crisis. And by doing that, we thought it was important, with our role as NASCIC and who we are, to bring together the community from all corners of North America, where we can share great ideas and strategies, and really how we're all dealing and coping with COVID-19 and as a community. So that's a great example of what we've done. So you can see these are examples of how we've moved and how we continue to move to help drive the community in a positive direction. But more importantly, bring benefits to members across North America of other organizations. This is not about being a member of our organization, but more importantly, bringing your membership where you are and adding that to what we are as a community as a whole with NASCIC. And we would like to thank all of you who are members so far, and really want to encourage you that are listening today to take this information and potentially become a member and have your organization become a member, because there's always, like we always say, there's strengths in numbers, and the larger and the louder we can be, the better we can be at what we do and helping our community. So today, we are blessed with having these great speakers, as I spoke to, but I'd like to introduce to you the Vice President of NASCIC, Jen French, who will take it away from here. Jen, take it away.
Thanks, Barry. Barry is our treasurer for NASCIC, and we appreciate you having that introduction. So to get our discussion going today, you know, COVID-19 is on the top of all of our minds, and part of what we want to talk about today is centered around that topic and how it really impacts our community of people living with spinal cord injury. So with that, we'd like to launch a poll. We want to hear from you in the audience. What's been the biggest issue that you've had to face during the COVID-19 pandemic? And we have 4 choices here. And I'm going to offer to you this is please put in the choice that you think is most prevalent for you personally. But if you have one or an idea or an issue that has been impacting you that is not on this poll, please put it in the chat box so we can talk about it. So go ahead and we want to hear from you. Please answer this poll in just a few minutes. Okay, Jess, how are we doing on responses?
We've got 71% voted. So if you want to give it a bit more time, or do you want to?
Let's give it a bit more time, just to, okay. So everybody can make sure that they put in their vote. Let's give it about another 20 seconds or so to give a quick response. Again, think about some of the biggest issue that you've faced. We've been in this COVID-19 for 4 months now, and I know we've all felt that, so we really want to see what's impacting you.
Okay, so I'm going to go ahead and stop it there.
Okay.
So,
all right. Well, I think they all are, aren't they? Thank you all for your responses. So look at this. So it's really interesting. 30% for both access to medical care and appointments and also isolation. And not far behind that, in the double 20% is care and supply shortages. So really, those are all topics that we can be touching on, and we are going to touch on today. So let's kind of dive into this with our speakers. I'd like to bring up Peter and Alex. So if we can bring them up.
Hello.
Yeah,
Hi.
Alex, hey, welcome.
Hi.
And Peter?
Hey.
Excellent. So as Barry said in the introduction, Alex Benowith is the Vice President of Government Relations for United Spinal, and Peter Annapolis. I am going to totally
Peter A.
Peter A. Thank you, because it's not rolling off my tongue. But he's the Director of Public Policy for SCI Ontario. So welcome, you guys. And you saw that poll. We kind of want to hear from you because you've been working on the policy end and also on some of the responses of COVID-19 to our population. So can you speak to a little bit about some of the lessons that we've learned as we're looking at the poll responses that are really kind of all across the board?
Yes.
Tell us, so kick it off, Alex. What have you been seeing of a lesson learned that we've learned over this period?
You know, isolation, definitely, I really, we've been hearing a lot of that from our members, and really it's obviously been impacting people across the community. Individuals that just have been scared to leave their homes for obvious reasons. And it is part of it, they're all connected, as we could see in how the results came through with, you know, access to caregiving and access to supplies. Because if you aren't able to leave your house, you know, how are we getting access to those things? And there has been, especially early on in this pandemic, it was so difficult to get supplies. And I know we were getting reports early that, you know, there was definitely price gouging going on. You know, for example, a box of 1,000 gloves went, you know, in one day from like $20 a box to, you know, well, $30 a box to $80 a box to $100 a box. And that can be very challenging, especially if people have been furloughed or have lost their jobs due to COVID. So all around, I mean, it's just, they're all interconnected, and it's been very challenging.
Peter, what have you seen on your end? Let's try to hit on isolation first, as Alex did. What are you seeing in some of the lessons that we've learned?
Well, I wasn't really surprised seeing the similarity to the important areas, because I think what's happened, from my assumptions, is the challenges have peaked in different points of the pandemic. I think early on, we saw a lot of anxiety around medical supplies and ensuring people are getting the products they need and ensuring they have enough in their home to prepare for isolation. And as time gone on, people's care started getting compromised and their wheelchairs started breaking down. And then a new issue arose around, well, how do I manage these things? And then through the journey over spending so much time at home, then isolation starts kicking in, from feeling sluggish, doing repetitive routines all along. I think we're all experiencing the same things in different moments, is what I gather has happened in speaking to our membership.
Thank you. Yeah, and in our chat, somebody's chiming in saying, you know, maybe it might not have been the supplies of catheters or some of their personal medical supplies, but some of those masks and other PPE for caregivers or cleaning. I mean, I know me as somebody living with a spinal cord injury, geez, finding alcohol swabs is some of the hardest things to come about. So what have we learned? How do we prepare for this? You know, if we have to prepare for another couple of months, or if we have to face another situation like this, what's some of the things that what's our takeaway, if you will?
Well, I think the biggest takeaway is that the spinal cord injury community needs an emergency response plan. I don't think we've had one. I don't think we ever needed one or expected to need one. We all individually look at what our emergency plans look like in our own households, but we've not looked at this collectively as a country or a province or as a continent to identify guidelines and best practices around a person's care and their needs, and the vital supports that they require. And hopefully in the future, we could, activate a response plan in a way where governments understand what to do, people understand how to protect themselves, and we can collaboratively work towards solutions, as opposed to everybody using, these are unprecedented times and let us do the research now, in the middle of a pandemic to figure out what people's challenges are. That's my biggest lessons learned, is that I don't want to guess anymore. I want to make sure our community is safe.
Yeah, Alex, would you like to add to that?
I just totally agree. And we actually, United Spinal actually sued the District of Columbia because they didn't have an emergency plan in place at all. This was before COVID. And we've been working through with the district government to put plans in place, different deliverables. And ironically, they had to postpone that during COVID because we had to take care of the immediate needs. And so definitely, to Peter's point, individuals in this community definitely need to think about that moving forward, because we don't want to be in this situation again and not be prepared.
And really to explore that idea, for those of you out there that might not know me, but I live in Florida, and we constantly have prepare for hurricane season and have all these plans in place, particularly for people with disabilities. But, what do we do in a pandemic? So as we saw what to do if you're a wheelchair user dealing with a pandemic, that was a resource I don't think we've ever thought of that we'd have to deal with, but that was one of the resources that came out of here. One of the things that we're trying to do at NASCIS is trying to pull together these resources so that we can start to have a playbook, if you will. Yeah. What's another kind of lesson learned when it comes, we've talked about supplies, but personal care attendants have been a real issue during this time. What have we learned to address that going forward, and possibly give some resources to people living in the moment?
I can start with that. I'll address some of this later in my presentation, but we have realized, we know, and we definitely have heard a lot about it during this challenging time, that many of our members, specifically at United Spinal, have multiple caregivers on different shifts, different times, not family members necessarily. And in legislation in the United States, for some of these COVID packages, only family members were being covered for some of the exceptions for COVID. So we were pushing to include non-family members in some of that. So that's an example. Yes, individuals who may have, caregivers who may have asthma, aren't able to come into the house to help the person. Things like that. If their own spouse, who is usually a caregiver, has some type of condition that it doesn't allow them to help, they have to self-isolate from each other in the same house. So many things that we couldn't have even imagined before.
Yeah, coming to light. And Peter, can you add anything to that from what you've seen?
Well, in Canada, we have a challenge because personal support workers, attendant services workers, were undervalued before this pandemic. And this pandemic really exposed the lack of attention and need by government officials on the field of personal support attendant services. In Canada, we use the word attendant services or personal support workers. So just to clarify some of my language, if people think I'm talking weird. But we've had a huge retention and recruitment problem across Canada, where people are struggling in the best of times to get the thresholds of hours that people need to be independent. And then when you compound that with a pandemic where you have one attendant going to 5 different supportive places, including multiple outreach places, like scraping a couple hours here and a couple hours there to make up their workforce, and then you add a pandemic on top of that, and then having to shrink the amount of attendance going to multiple places, it really put people in vital situations. In Canada, we had to employ legislation to redirect hospital staff into community settings where retention of PSWs who are working in multiple places, personal support workers, sorry, were impossible to mitigate. So we worked really hard to ensure that no person went unvisited. We were successful in achieving that goal to this date, but it had to do with legislation forcing other care workers to work into the community.
You know, Peter, thank you for mentioning that. And that's a great dovetail into our presentations. So at this point of our meeting, we'd like to go into some presentations because we talked about what are the lessons we've learned, but what are we doing about it? So Alex is going to step up first to talk about what some of the advocacy work and some of the steps that are being taken to improve and to try to change what we've experienced in the spinal cord injury community. And then Peter will do the same in terms of what are we doing in Canada and what are some of the policy changes and advocacy changes that they're working on. So with that, I'd like to hand it over to Alex. Alex, go ahead.
Thank you, Jen. Appreciate it. I appreciate the invitation and to present to you guys. So as you can see, I guess we can go to the next slide, Jessica. Yeah, so just quickly, I wanted to explain our virtual advocacy series where we did talk in detail about the impacts that we just talked about a little bit, caregiving and PPE, personal protective equipment that we call it in the United States. We moved on just yesterday. We had a call about technology, and so technology and the telehealth, the telework, the assisted technology and transportation side of things as we're transitioning out of the immediate needs of COVID. And I'm going to talk a little bit more about that in the upcoming slides. And just quickly to flag our celebration in the United States of the 30th anniversary of the ADA, July 15th, and we'll have a webinar there. But let's go to the next slide. Thank you. So we talked about some of this stuff already, so I don't need to belabor the first 2 points. Obviously, we all know that. There's also challenges with, there were initially limited access, those limited accessible testing, right? We actually did a state action in New York where an individual was not by the window of the car because where he was secured was away from the window. And he was denied a test because at that time they were just going through the window and the healthcare worker could not reach. So he was denied a test. So we had to do a state action with the New York governor to mitigate that. And I know that in DC as well, they've made some adjustments as far as accessibility. But the same thing with transportation. The problem is, as we all have experienced, and that's part of why there's been a lot of focus on technology now in transportation, because that's something that those of us that are still lucky to be working are all working from home or having challenges getting to places because routes have been canceled and closed. I mean, our train system in Northern Virginia has pretty much shut down, and my train line doesn't open until mid-August. So yeah, everyone's being impacted by that. The less rehab options, individuals that aren't, now that everyone is at home, not being able to leave the home, where they would usually go for adaptive gym engagement. All those adaptive gyms were converted to COVID facilities. And so what happens to that piece? And so that's where a lot of these technologies came into place with the telehealth and the wide lifting of restrictions, lifting restrictions on telehealth, which is helpful for our population. But of course, it cannot always replace in person. We've got to be mindful of that. Wherever there is telehealth, we have to make sure that there is the expertise there. Just quickly, medical rationing. This has come up related to COVID because we saw a lot of individuals, all of different facilities, decide in an old school manner who was worthy of receiving equipment or treatment, worthy in quotes. We actually wrote to the Health and Human Services Office for Civil Rights to remind them of the guidance of the Americans with Disabilities Act and some other bills that we have in the United States that make it illegal to discriminate. And so for COVID, you know, for an individual, just the disability diagnosis or the disability condition has no impact on whether they should be eligible for COVID treatment. And that's the case we made with a lot of other footnotes and citations. And the Office for Civil Rights issued a bulletin, a guidance bulletin, and I'll have the link for that later in the slides. Shortly after that letter that they received from us within the disability community, including United Spinal, that kind of highlighted those issues, that they weren't going to do that anymore. And it's helped with a lot of cases that have happened in the States where we've been able to pull back those crisis standards of care where they just, you know, automatically decide if they're going to treat or not, or provide therapeutic intervention for. So we've been able to stop that in many states so far. We'll continue to follow that. Job loss, you know, we've mentioned that a little bit. I mentioned it a little bit before. You know, because of the COVID crisis, there's a survey that came out earlier this year, Global Disability Inclusion, that stated that 38% of people with disabilities have been laid off or furloughed, had to shut down their businesses due to COVID. And that is challenging and that's upsetting. But again, I push individuals to think about the options for telework and additional technologies. And then, you know, we also get a lot of questions that come into us about guidance as far as individuals, if they still do have their job, how do they engage back, you know, going back into the office? If they're not ready to do that, they don't have to be forced to do that. That's also against the ADA. So we've had a lot of things, a lot of questions like that come into our resource center. So that's another important point to raise. And then, of course, food delivery services, a challenge again linked to the caregiving. If a caregiver is unable to come to a person's home or be in a person's home to do the grocery shopping or to go with that individual to do the grocery shopping, that person doesn't get food that they need. And, you know, here we experienced food delivery services being, you know, the home delivery was you couldn't get a window for delivery, basically. So that's been very challenging, but there have been a lot of new companies out there that have engaged in that service now, in addition to just the traditional supermarkets, which is helpful. Okay, next slide, please. So I'm not going to go into all of this. This is just a quick overview of all the different things that have been happening since early March. You know, we had the really quick, you know, coronavirus appropriations on testing and PPE and small business loans and vaccines. COVID package 2 focused more on tax credit and unemployment benefits and paid leave, which I referenced earlier, but and that was passed mid-March or so. Next slide, please. And then 3 was the big bill that really United Spinal was really engaged in, and a lot of the disability groups here in the United States were engaged in. It did have a lot of good stuff for us related to a good chunk of money for our aging and disability resource centers and service programs. As you can see, the CILS, that's Centers for Independent Living. So there's an independent living center in every state, which is helpful, obviously. And moneyful as the person refers to providing money for states to have more transition funding for individuals to get out of institutional facilities and into their communities, which obviously we support. Of course, support permanent extension of that, but money is always the issue, and they at that time, back in March, extended it through November. But we're always pushing for permanent extension of getting people out of institutions into the communities, especially now, of course. We don't want to, you know, spread infection into our communities. And then, you know, 3.5 was more funding for small businesses and hospital testing. Next slide, please. So, you know, there is a fourth package that's been discussed. It's going to be pushed out to after July. So I'll get to that in the next slide. But I wanted to highlight, you know, I know that Barry mentioned we have to have a large voice, and that is true. And definitely, you know, we can work together and can speak up and speak out. But it doesn't have to be intimidating when we're advocating. I mean, there is a great quote from Margaret Mead, American cultural anthropologist from the 1960s and 70s, who said that never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So, you know, as the SCI community is a relatively small community in the whole scheme of things, but it does not mean that we cannot be successful. And we have made successes. We've been able to focus on paid leave issues. With the CARES Act, there was Medicaid, home and home community-based services funding. We were able to push the Office for Civil Rights protections that I mentioned earlier. There's HEROES Act, which I will talk about in the next slide a little bit. But there was a lot of focus on home care workers when all this discussion about COVID. And obviously everyone appreciates our brave frontline workers. And that's what the HEROES Act is named after, actually. Passed in the House in mid-May. And it points to providing more supports and funding for personal care attendants. So there's a lot of things that we have done in pushing. As you can see, those are some of the other things. Transportation and infrastructure. There's a lot of discussion around 5G and extended broadband issues, better cleaning protocols for our membership, and definitely an increased focus on telehealth and telerehab. So I mentioned a little bit about that before, but all really important things. And I think this has really been a catalyst. I know there's been a lot of challenges and a lot of sadness, but it also has been a great catalyst for some good discussions about hopefully keeping issues alive on the issues that matter to this community and pushing those forward. So we've definitely made some good success, and we can definitely keep moving that forward. Next slide, please. So I just quickly mentioned the HERO. Everything in DC has an acronym. If you can imagine, we're able to come up with the HEROES Act, Health and Economic Recovery Omnibus Emergency Solutions Act, which I mentioned. It had a whole thing related to, as I said, personal care attendant support and things like that. There's also the Connect for Health Act, which is another crazy acronym that I'm blanking on right now. Let me just tell you because it's fun. Okay, creating opportunities now for necessary and effective care technologies for Health Act. And that's all about telehealth. It's all about looking at lifting restrictions during national emergencies, lifting restrictions on the use of telehealth for mental health services, which obviously is an important issue as well at this time. And just the last couple of weeks, there's been a push to make that permanent. So beyond COVID, just have it permanent. And again, I support greater access, of course, but we also have to be mindful that it's the right access and you have the right experts providing the care. That's where United Final stands on that position, on that issue. Just quickly, I think I'm kind of in time when I have time for Peter to talk and some questions. The Invest in America Act, again, this is actually from some provisions that we were able to get prior to COVID, related to improving the transportation network in the US. Unbelievably, we don't have an online system for complaints with the Department of Transportation. So one of the provisions that we pushed for was doing that, because the current system is inaccessible. It's just a PDF page on a form, which is not helpful, on a website, which is. So there's that, and we improved paratransit by having an additional stop. So you don't have to just do one stop per ride. If you, God forbid, have to do two things in one trip, like picking up your kids and going to the grocery store at the same time, so you can do two things instead of just one. And some things like that. So those that bill got included in the Surface Transportation Bill, which will be pushing for the new funding cycle in October. Next slide, please. So those were the two bills I mentioned before. I did want to also reference quickly the Nursing Home COVID-19 Protection and Prevention Act. And again, that's another issue related to ensuring that nursing homes can safely care for all residents. There's some protocols in place that they have to do, because we've seen the focus on nursing homes in this country. Also, there's a READY bill in the U.S. related to emergency preparedness. It's called READI, R-E-A-D-I, which is another thing to help dealing with all these things. Looking at the needs of the disability community. But those are two bills, a couple of calls to action that I mentioned, a little bit more information there. And that's our Action Center page. Next slide, please. And so hopefully I wasn't rambling too much. I know there's a lot of information to go through, but please take a look at those links. I'm happy to chat them. I know these slides are going to be shared later. But there's a lot of guidance on the resources and guidance page and the COVID support page for any issues or challenges you may be facing. So please take a look at them. So thank you. Hopefully I didn't take too much time.
Oh, Alex, that was great. Thank you so much for that overview. And again, Alex mentioned that the PDFs will be up on our website. So any of those links that are provided, you'll be able to take those, and please take heart to some of those take action items that she had on her slides. Now we'd like to bring up Peter A. There's Peter A.
There you go.
And Peter, please tell us what's going on your neck of the woods.
Yeah, so I'm going to be speaking in the context of Ontario, Canada, but recognize that we've been aligned with all our provinces, and we have a federation at spinal cord injury where we have non-for-profit organizations in every province across the country. But I will focus in the context of Ontario, and then highlight some national initiatives as well. So next slide. So in terms of the topic areas, when we spoke in the original, in the introduction of today's meeting, I highlighted the need for an emergency response plan. Our approach in Ontario was just that. In the early days of looking at what was ahead of us, a group of policy advisors and community organizations and people with spinal cord injuries came together and started saying, well, what are the elements that we're going to have to face here? And let's start thinking ahead, and let's start putting information and education in the ears of our governments to be prepared as best we can, with a motto that none of our community members will be affected by COVID-19. So that was our strategy, and that's how we approach the situation, and that's what we continue to do today. So the topic areas that you're going to see are the elements of how we're building a plan towards a response plan for people with spinal cord injuries. So next slide. So in terms of uniting as a community, once the pandemic hit, for us in Canada, it came officially very strong on March 11th, where we started seeing a whole bunch of shutdowns, including our organization, Spinal Cord Injury Ontario, who quickly went into a virtual model immediately within 24 hours. So when the pandemic hit us, our first call to action was to call all our clients regularly. We set up a call center. We organized our clients from high risk to moderate risk to low risk, and we essentially started screening everybody we serve in terms of what they need, and then started building plans around how we can support them. Further then, we quickly launched our virtual information platform called VIP for SCI. This is a platform where we can actually convert all our services into online supports. It's something that we've been working on for some time. We weren't planning on launching it till later on this year, but because of COVID, we actually made it production and operational within 30 days after the pandemic initially hit. And what VIP essentially does is allow an individual to develop a circle of care virtually, adding their vendor, their doctor, their peers, and their other sources of networks into a virtual meeting where it could address some of their issues that they can, and data collect as well as information and resource collect. So we quickly started registering people onto our platform so we can communicate them most effectively. We also set up Zoom calls every 2 weeks where anybody and everybody who wanted to have a discussion around COVID-19 and what we're hearing, what evidence can we use to support some of the challenges we're facing by province. It was our way of powwowing to support each other and looking at how we can leverage each other's legislations to provinces, to other provinces, and stay connected and succinct. We launched COVID updates on our website where we continuously populated different aspects that we thought people would find helpful in terms of mental health support, isolation support, medical supply support, mobility device. It's pretty comprehensive if you click on that link. We also set up a YouTube channel to set up certain things where people can learn how to care for their respiratory needs or care for their bladder needs. Like we literally got clinicians to start videotaping themselves so then people could have a resource in crisis. And as well, we supported our community through a variety of different calls to actions federally and provincially. In our country, as particularly in Ontario, we felt that our government was not supporting people with disabilities, and all the news and all the incentives and relief funds were really not pointing to people with disabilities. We were really left out of the conversation. So we started heavily press releasing, and you'll see through the AODA Alliance, which we use as a platform for the media, we were writing to papers, getting ourselves in the media to get our premiers and our prime minister to acknowledge us as a vulnerable population, because that didn't come so easily, as well as creating knowledge exchange through our learning platforms, and as well converting exercise and rehabilitation classes virtually to keep people active, keep people inspired, keep people healthy, and prepare for an isolation for some time. Next slide. So our biggest hurdle very early on was home care, right? Like, how are we going to get the vital supports that people need in their homes available to them in a safe and secure manner? I touched a little bit about the legislation that we had to employ around attendant services, as well as advocating for testing. You know, in Ontario, 80% of the cases of COVID were in long-term care facilities, which my understanding, according to the news, is one of the higher percentages of cases across the world. Canada has experienced more long-term care cases than most places around the world. So it was a real exposure to the need for more proper PPE and supports in our long-term care facilities, as well as our outreach facilities and supports in people's homes. So we really early on focused on testing and making sure our PSWs were safe and not going into an environment where they can expose somebody else. We set up daily screenings, not only the individual, but as well as the attendants. Made PPE mandatory immediately, and no personal support worker was entering a person's home without a mask, and so on and so forth. We're also coordinating necessary hospital visits, right? There was guidelines that was produced in Ontario by our government very early on that suggested that no visitors were allowed in hospitals during COVID, and recognizing that some high-level spinal cord injuries or other complex needs would need some kind of support entering a hospital, waiting in an emergency room, needing support with ICs or any jackets or any other supports through an attendant. We wanted the ability for a support worker to have the ability to go to the hospital with a person with a spinal cord injury if it was absolutely necessary. So we were able to achieve that, not legislatively, but through the Ontario Hospitals network, where it's a network where all the hospitals sit. We pitched to them, we provided them information on the importance of this provision, and for the most part, all hospitals had accommodated when necessary. Also, what was very new in Ontario that was never in place prior to the pandemic and was created by the pandemic was physician billing virtually. So in Ontario prior to the pandemic, you couldn't communicate with your doctor without the physician being paid. So you can imagine the only way you would actually have a successful appointment is if you were in person. One thing that our government did really early on, and it was in the verge of doing it anyways, and we were advocating really hard for them, but we commend them for doing it immediately and minimizing any risks or liabilities by just simply having family physicians or specialists having the ability to contact their entire caseloads and manage their health. So that was happening as well, which we were happy about. We also had to respond to hospital triage protocols. So really early on, medical professionals came out with protocols in the event that a hospital was completely at capacity, how they would make decisions on how they would treat people. And unfortunately, in Ontario, the draft guidelines were identifying people with disabilities, singling out certain disability groups, and as well using language in terms of recognizing a person with a disability as unequal to the general public. So we forced our government to ensure that their draft guidelines were vetted by our Human Rights Commission. We were able to achieve that. Now, the good news is it's never left draft because we've not experienced a full capacity anywhere in Canada in terms of COVID cases. So the situation's kind of been silent because of there hasn't been a need to react to the protocols, but they're certainly being revised, and we certainly don't want to see the language that we saw in our protocols ever publicized again. We started commissioning independent reviews, particularly in our long-term care facilities, because we've seen such a high, enormous amount of cases and deaths. So we're trying to expand those commissions into home care and attendant services as well, because again, we've experienced seeing our governments treating people with disabilities in their support home care settings as afterthoughts. And then lastly, similar to what Alex was talking about in getting transportation services, we lobbied the government for an investment to ensure that if anybody with a disability that couldn't get out and didn't have a social network or family members support who needed supplies and food and necessities, that we had a system in place where we built a volunteer base across our province where people can contact an organization called Meals on Wheels who would facilitate direct groceries and transportation directly to people's homes. Next slide. In terms of medical supplies, we worked with our corporate manufacturers to ensure that we had a 30-day medical supply for every one of our clients in the case that they did not. We were really concerned around people starting to reuse catheters and risks of higher infection and UTIs. Thankfully, we were able to mitigate all that by ensuring we had enough medical supplies through manufacturers and donor supports. This was a real critical issue for us. So we launched a fundraising campaign called Safe at Home to start raising money to actually pay for people's supplies when they didn't have them. And we raised a significant amount of money to be able to pay for specific equipments and specific supplies to be able to do that. We in Ontario have been working on a priority of belief that a person should not have to pay to go to the washroom. So we already had a strategy and working towards a strategy to get our government to legislate a full funding model for accessing medical supplies in Ontario. We're continuing to do that, and we continue to highlight COVID as a good example of why the importance of this in our province and country. And we continue to do this work and invite and engage our community into strategies of advocacy where we can address our P4P strategy. And our intent is to do that in the next budget cycle of the Ontario government, and we're continuing to prepare for that. In terms of PPE, gloves, as well as Alex presented, was a huge problem. We found it really hard in getting these things. All our manufacturers of gloves deployed gloves only to hospitals, and the pharmacies and other home care providers were lacking of getting them. We were able to strike a deal with the government to create an inventory specialized for community services to solve that problem. In terms of hand sanitizers, we had to be extremely creative and get our alcohol distillery companies to convert their gin making production into alcohol sanitizer production, and it actually worked really successfully. And people in these distilleries were actually happy to help their communities in diverting their product into products that are essential for the pandemic.
Hey, Peter, we're going to have to wrap it up in about 2 to 3 minutes.
Okay. If you go to the next slide, I'll quickly talk about mobility devices. We were able to expedite approvals, get our mobility devices essential, and then work on a donation of equipment when people were finding things broken, and as well as, again, authorize OT visits. If you go to the next slide, Jess. And as well, we really worked on income supports federally. So here was all the strategies that we were able to achieve in terms of getting people with disabilities funding, recognizing that there was a higher cost. People were charging more, delivery costs were higher. So we were trying to get money in people's pockets. And our approach in government was really talking to them directly. We didn't write position papers or briefs and do the traditional route of how you would lobby and do government relations. We essentially got ourselves at the table and started demanding what we need. And that seemed to be effective in the time, as a lot of offices were closed down. Next slide. And in terms of next steps, we're working towards an evaluation and an environmental scan of our emergency response plan. We're continuing to commission more reviews. And one area of interest for us is to actually capture the lived experiences by finalizing some funding to actually do a documentary on the life of a person with a disability and a spinal cord injury during COVID-19. Thank you. That's it for me.
Excellent. Thanks, Peter. And thank you, Alex. Those are some great presentations, not just of what we've been dealing with COVID-19 for the spinal cord injury community, but also what actions are being taken. So again, these slides will be up on our website, so you can look at the links. Alex has put up a couple of links that she mentioned during her meeting or her presentation as well. And we'll have those same ones up for Peter as well soon. So thank you very much, guys. We appreciate what you've been doing and however we can advocate for you, which is great. So stand by, everyone. We're going to have a call to action slide coming up here in just a minute. But I want to take a quick moment in interest of time to really talk about what our next meeting is. So this year we're doing quarterly meetings for NASCIC, and our next meeting will be in September. And we wanted to poll you. We wanted to find out from you what type of topic do you see that was really important and you would like to see covered. So we're going to throw up a poll here. And we wanted to throw up a couple of options of what our main topic will be during our next quarterly meeting in September. Would you like to see new primary care resources that are coming up? Those are being put out by several SCI physicians with people with lived experience and really talking about some of those care resources that are going to become available, so you could take them with you when you go to your primary care physician. What's going on in SCI clinical research update? It'll be an overview of what's going on in SCI research, but more so clinical research on and how it's going to impact us as a community. And another topic that we might be able to cover is how to become an active partner in research, and how do you become a consumer advocate or consumer engaged in the development of research, so your lived experience can help influence the way that research goes and how we design it. And of course, if you have any other ideas, please toss them into the chat, but go ahead and put up your vote. We'll give it about 30 seconds in interest of time, so we can be able to talk about some of our other call to actions. So what would you like to see in our next quarterly meeting in September? Okay, Jess, let's see what we have for a response. We want to see what people are saying out there. All right, so it looks like primary care resources is the one that came out on head, but we will keep in mind there are still several of you that are interested in SCI clinical research updates and how to become an active partner in research. So we're going to take those to heart. Maybe it might not be in our September meeting, but we'll make sure that we put out those primary care resources, and we'll use that as one of our topics going forward. So I'm going to close the poll, and I'm going to hand it over to Barry, because Barry is going to talk about some of our calls to action coming forward, coming out of and during COVID-19. Go ahead, Barry.
Thanks, Jen. Thanks again to our speakers. That was an excellent presentations, both of them were. So we have really a few things on the go that working with our partners, and we thought we'd come back and ask you to help us with our call to action. One is a project that's gone through our project review committee, and it's the University of Minnesota, who is conducting an online telephone-based survey that's really the purpose is to identify the impact of COVID-19 pandemic on individuals living with SCI with respect to both medical rationing and access to personal care attendance, much like we've talked about today. So the survey has been approved by the University of Minnesota and has been approved by our project resource committee. And here is the link. And if you have any questions, please contact Dr. Kimberly Moden. But if you could, please fill out the survey and pass the survey on. The more people that participate in the survey, the better. That'll just give us a better take on what's happened. And like Peter said, let's learn from our lessons and see what we can do going forward. Also, the United Spinal Association, they are putting together through the HEROES Act support for this, the HEROES Act, and then you can click and take action there. So go to the SCI, the United Spinal site for that. And also they're looking for support provisions to invest in the America Act. And again, that's another action item that you too can be involved with. And please go to the United Spinal site and do that as well, and really get behind it. This is what it's all about. As a community, if we're silent, things just don't happen. If we let our voice be true and be true to what we want to say, then clearly we can make a difference. And then we also, this is a plug for what we're doing internally is with the SCI moving forward. We have a webinar series with multiple resources from all parts of North America connected to each webinars. And we are also, just as a caveat, all the webinars are being subtitled into Spanish for our Latin brothers and sisters in North America who want to benefit from this. So the SCI Moving Forward website and series is available. We're archiving the webinars every Tuesday going forward at 4 p.m. Eastern is our time slot, and that's when you can tune in for there. And there's the link below. You'll see that there. So we encourage everybody to check out the webinars from the past and potentially be part of it in the future. And again, spread the word for all these great initiatives and our calls to action.
Thanks for the opportunity, everyone. I really enjoyed this. Thanks for having me.
Listen, everybody, thank you. And Peter and Alex, you did a great job. And Jen, again, great working with you. But thank you. And thanks, Jess, for working those slides for all of us. It's always most important.
Jess makes us look good, definitely. Thank you all for attending.
Gotta make sure that there's good flow.
Thank you, everyone. Appreciate
Thank you.
Thank you, everyone, for being part. And let's be well. And if you need anything, please reach out to us and we can connect you, if we can, to anybody in your region on the front lines the best we can. So take care and be well, everybody.
And I just want to end with this was recorded and will be available on our website shortly within by next week, I would say.
Excellent.
So if anyone missed it, you can pass it along.
Great. Thanks, Jess.
Thanks, everybody. Have a great day.